Fibroids are benign uterine tumors. The majority of fibroids are asymptomatic. Only some symptomatic fibroids require treatment. The main symptoms of fibroids are bladder pressure provoking the need to urinate many times a day, long heavy periods lasting more than a week, constipation, lumbar and abdominal pain that can even upset intimate relationships, difficulty to fall pregnant, and repeated miscarriages. Fibroids can cause infertility. Fibroids often get larger during pregnancy due to the increase in the woman's hormonal activity. There are different treatment options, ranging from conventional surgery or laparoscopy surgery, which eliminate fibroids more aggressively and require general anesthesia, to newer treatments such as radiofrequency. Radiofrequency is a technique which is minimally invasive for the patient. It does not damage the myometrium, leaves no scar, and can be used in all fibroids under 10 cm diameter that are accessible vaginally. This is an outpatient treatment that does not require anesthesia, just light sedation, and the patient can return home a few hours after the procedure. Ultrasound-supervised treatment can be carried out vaginally. An ultrasound-guided needle connected to a radiofrequency generator emitting a controlled amount of heat through its end is inserted into the fibroid and burns it from the inside. This technique allows several fibroids to be treated simultaneously. Elimination is achieved through a slow reabsorption by the body. The radiofrequency procedure takes around 40 minutes, is painless, and does not cause bleeding. The patient may return to her normal daily activities the day after the procedure. The patient must just undergo a gynecological.
A fibroid is a benign tumor that mainly consists of muscular tissue and usually grows inside the uterus. Fibroids are also called myomas. Its size ranges widely from a small tumor the size of a pea to a large tumor almost the size of the uterus. Myomas are classified into 3 types depending on the location where they're found. The intramural myoma, a fibroid that grows in the muscular wall of the uterus. The subserosal myoma, a fibroid located just beneath the outside mucosal covering of the uterus. Here, the fibroid projects to the outside and occasionally remains connected with the uterus only through a small stalk. The submucosal myoma, a tumor that grows beneath the surface of the uterus lining. Therefore, this type of fibroid can grow in the uterine cavity. The actual causes of development of a fibroid are still unclear. However, it has been documented that fibroids are associated with high levels of estrogen, the female sex hormone. Fibroids can only develop during reproductive years of women. Following menopause, the production of estrogen decreases, which will usually cause fibroids to shrink or disappear. Myomas are more common in non-pregnant and infertile women. In general, fibroids are asymptomatic or associated with just a few complaints. If any complaints occur, then the location, size, and type of the fibroid are the major factors. Fibroids can affect nearby structures. They can cause compression of the bladder, which may lead to urinary complaints, or may obstruct the intestine, which may result in constipation. Other complaints can be backaches, abdominal problems, menstrual flow disturbances. Fibroids can impede normal child.